Renal artery stenosis is an renal disease. Look at this picture, shows that kidney and renal artery stenosis. Look at this. Then computer tomography angiography, magnetic resonant angiography. Look at these pictures. Then Doppler ultrasound and renal angiography. Look at this picture. It's a gold standard contrast dye use and to visualize arteries. Stenosis. Look at this. A detail going on. Introduction. Renal artery stenosis RAS is a significant condition that leads to reduced blood flow to one or both kidneys. It is a common cause of secondary hypertension and can contribute to chronic kidney disease and end-stage renal disease. Early diagnosis and management are essential to prevent complications and maintain kidney function. Definition. Renal artery stenosis refers to the narrowing of one or both renal arteries which supply blood to the kidneys. This narrowing reduces oxygenated blood flow, leading to kidney dysfunction, hypertension, and other systemic complications. Etymology. The term renal artery stenosis comes from Latin, where renalis means related to kidneys. Arteria refers to the blood vessel supplied to the kidneys, and stenosis derived from Greek stenos, meaning narrow. Together, the term describes the narrowing of renal artery which can lead to reduced blood flow to the kidneys. Types. 1. Atherosclerotic renal artery stenosis. Most common type, 90% of cases, caused by plaque buildup in the renal arteries, common in older adults and those with cardiovascular disease. 2. Fibromuscular dysplasia, a less common cause, more prevalent in younger women, characterized by abnormal growth of cells in the artery walls. Causes. 1. Atherosclerosis, block, buildup, narrows arteries. 2. Fibromuscular dysplasia, abnormal tissue growth. 3. Inflammatory diseases, vasculitis affecting arteries. 4. Embolism, blood clots. blocking renal arteries. 5. Radiation therapy, damage to arterial walls. 6. Congenital abnormalities, structural defects from birth. Risk factors: 1. Age more than 50 years for atherosclerosis related to RAS. 2. Smoking. 3. High cholesterol levels. 4. Diabetes mellitus. 5. Hypertension. 6. Obesity. 7. Chronic kidney disease. 8. Family history of cardiovascular diseases. Complications: 1. Resistant hypertension uncontrolled with multiple medications. 2. Ischemic nephropathy, loss of kidney function due to reduced blood flow. 3. Congestive heart failure. 4. Acute kidney injury, AKI. 5. End stage renal disease. Pathophysiology. Pathophysiology of renal artery stenosis. Step by step process. 1. Narrowing of the renal artery. Atherosclerosis in older patients or fibromuscular dysplasia in younger patients leads to the progressive narrowing of one or both renal arteries. To reduce renal blood flow, RBF, the stenosis decreases perfusion pressure, reducing blood flow to the affected kidney. 3. Activate one of the renin angiotensin aldosterone system, the juxtaglomerular apparatus. Kidney senses lower perfusion and release renin. Renin converts angiotensin from the liver into angiotensin 1. Angiotensin 1 is converted into angiotensin 2 by angiotensin converting enzyme in the lungs. 4. Effects of angiotensin 2: vasoconstriction increases systemic blood pressure to compensate for reduced renal perfusion. Aldosterone release stimulates the adrenal gland to release aldosterone, leading to sodium and water retention, increasing blood volume. 5. Hypertension development due to vasoconstriction and fluid retention. Secondary hypertension develops. renovascular hypertension. 6. Kidney damage and ischemia. Prolonged ischemia leads to nephron damage, reduced glomerular filtration rate GFR, and eventual renal atrophy if untreated. 7. Contralateral kidney compensation. The unaffected kidney may experience pressure natriuresis, increased sodium excretion to balance blood pressure, but this compensatory mechanism is often insufficient. 8. Progression to chronic kidney disease CKD, persistent ischemia and hypertension can lead to chronic kidney damage and eventually kidney failure. Signs and symptoms: 1. Severe hypertension. 2. Sudden onset of high blood pressure in patients less than 30 or more than 50 years. 3. Unexplained kidney dysfunction. 4. Flash pulmonary edema. 5. Abnormal urine analysis. 6. Oozing sound heard over renal arteries. Diagnosis: 1. Blood test to assess kidney function. 2. Urine analysis detect proteinuria and hematuria. 3. Doppler ultrasound first line image test. 4. Computer tomography angiography CTA provides a detailed view of renal arteries. 5. Magnetic resonance angiography MRA alternative to CTA to assessing stenosis. 6. Renal arteriography gold standard confirms diagnosis via contrast dye. Nursing diagnosis: 1. Ineffective renal perfusion related to arterial narrowing. 2. Risk for imbalanced fluid volume related to impaired kidney function. 3. Altered tissue perfusion related to hypertension. 4. Deficient knowledge regarding disease management. 5. Risk for electrolyte imbalance due to impaired renal function. Medical management, disease management. 1. Antihypertensive medications, ACE inhibitors, ARBs, beta blockers. 2. Lipid lowering drugs. 3. Antiplatelet therapy. Aspirin. 4. Diuretics. 5. Percutaneous transluminal renal angioplasty. PTRA. Balloon dilatation to open narrowing arteries. 6. Renal artery stenting. Insertion of a stent to maintain blood flow. 7. Surgical revascularization for severe cases. Nursing management. 1. Monitor blood pressure regularly to assess renal function. BUN, creatinine, urine output. 3. Educate patient on medication adherence. 4. Encourage lifestyle modifications, low sodium diet, smoking cessation, exercise. 5. Monitor for signs of fluid overload, edema, weight gain, breathlessness. Treatment options. 1. Medications to control blood pressure and cholesterol. 2. Lifestyle modifications, diet, exercise, smoking cessation. 3. Interventional procedures, angioplasty, stenting. 3. Surgical interventions, renal artery bypass in rare cases. 4. Dialysis or kidney transplant for end stage renal disease. Psychosocial medicine. 1. Patient education, empowering individuals with knowledge about disease and self-care. 2. Counseling and support groups, emotional support for anxiety and stress management. 3. Cognitive behavioral therapy, CBT, to address psychological distress. 4. Social support systems, encouraging family and caregiver involvement. 5. Lifestyle coaching, assistance with behavioral modification and adherence to treatment. Prevention. 1. Maintain a healthy lifestyle, diet, exercise. 2. Regular health checkups. 3. Control risk factors, hypertension, diabetes, cholesterol levels. 4. Avoid smoking and excessive alcohol consumption. 5. Manage stress effectively. In conclusion, renal artery stenosis is a serious condition that can lead to severe hypertension and kidney damage. Early detection and intervention are crucial in preventing complications. A combination of medical treatment, lifestyle changes, and interventional procedures can help manage the disease effectively. Patient education and psychosocial support play a vital role in improving quality of life and adherence to treatment plans. Thank you. Have a nice day.